1, 2, 3. Now that number one, the number one represents the ophthalmic branch. The ophthalmic branch. That means the sensations that go to the eye region, the ophthalmic branch. They represent the maxillary branch. The maxillary branch, the one that goes to the nose region, while the number 3 represents the mandibular. We now know the mandibular branch. That is number 3. From the research in the University of Benin, it was clearly seen that trigeminal neuralgia in Nigeria, the number 2 and 3 are more prevalent. Number 2 and 3 are more prevalent. So you can see what SuperLife is doing for helping to educate us about conditions that are prevalent in Nigeria. A lot of you that have been connected week in, week out, you are now medically exposed, medically charged, and you can, even explain to some other lay people about the knowledge you are getting. Let's move quickly and look at the types of trigeminal neuralgia. Trigeminal neuralgia. There are two most important ones. Then we have one, not too serious type, but yet it is out there for medical personnel to battle their head with. Let's look at the very two most important ones. We have the classic or primary trigeminal neuralgia. That's number 1. Then we equally have the secondary trigeminal. Then the third one, not too common, is idiopathic trigeminal neuralgia. So let me take them again. We refer to it as classic or primary TN, number 2, secondary TN, and number 3, idiopathic TN. And look at all so that your participation into this lecture will really be, wholesome. You'll be going back home or lying on your bed knowing fully well that you have learned something today called SuperLife Nigeria. Let's look at classic or primary trigeminal neuralgia. Now, this particular one, of course, once there's a compression, I said it earlier when I started my introduction. Once there's a compression of the trigeminal nerve, especially root of the nerve by a blood vessel, and most times the particular blood vessel that is responsible or that could be responsible for this is the one we refer to as the superior cerebellar artery. So once this is on the trigeminal nerve root, then you now find the patient having this electric shock on the skin. On the skin of the face, for seconds and sometimes a few minutes. So once this occurs, the patient is going to have this sharp, shocking pain on the side of the face. I want to repeat this. In some patients, it occurs just on one side of the face, while in other cases, we have equally seen patients reporting this shock or this electric shock on both sides of their face. So it's something that is very common. As a matter of fact, it is the most common TN in Nigeria. It's the most common TN in Nigeria, the one that has to do with compression of the trigeminal nerve. Look at the second one quickly, which is the secondary. Now, the secondary TN, this one is where the patient has been exposed to other injuries, medical conditions. Once the patient has been exposed to other medical conditions like multiple sclerosis is a very chronic degenerative disease that affects the central nervous system, especially the brain, spinal cord, as well as the optic nerves. A patient with multiple sclerosis, you will now find out that such a patient is predisposed to TN. So now when this TN is occurring as a result of this particular kind of disease, then we are looking at secondary. That thing that can bring about secondary TN is tumors. When tumors, the patient is having tumors, or when the patient is having arteriovenous malformations. All these are medical terms that to go into them, we may need more hours. Or in some other cases, when there's a trauma to the face, the head, or even the brain. Now, once this happens, it can damage the trigeminal nerve. Once there's this trauma, once there's a blow to the face or an accident to the head or any part of the brain, that alone can cause damage to the trigeminal nerve, to a condition medical as trigeminal neuralgia. So please, I want us to please take note of this trauma. So please, people who are engaged in activities that can lead to trauma, please do your best to avoid it so that you do not trigeminal neuralgia. So please take note. Now, some of the characteristics that are common with secondary TN, going to have some sharp pains to the skin, and as lengthy as that of. Now let's look at the third one. The third one is idiopathic TN. Idiopathic TN. Now, medically, when medical personnel are faced with TN, there are times to identify when a TN is primary or when a TN is secondary. But there are cases too where they cannot place it, whether it is primary or secondary. And this is identified either through imaging or other diagnostic tests. Usually, the medical personnel classify this TN as purely idiopathic. Please, I hope all of you are getting. Let's go to our chat site and just indicate that you're hearing me loud and clear and that I'm clear, audible. Please, I will appreciate it. So today we're in about, and it is good that we are getting to know a lot about this condition. Now, idiopathic TN is the least common, type. So most times, and most of the presentations are either primary or secondary. That is why most times the doctors can easily get confused. So there's really need for proper imaging or other diagnostic tests to rule out idiopathic. This is either as a primary or a secondary TN. Let's look at some of the symptoms and causes of neuralgia. So, what I have told you is that this particular condition brings about a sudden incident to the face of the patient. It lasts for a few seconds and sometimes few minutes. And once that is off, the patient goes back to being normal again. But shock to the skin is not something palatable because it comes with pain. And sometimes in some patients, it comes with muscle spasm, that is muscle cramps. And the muscle around that place begins to cramp, like muscle cramps. For those who play football or do sporting activity, they understand what I mean by muscle. And if you're having a muscle cramp to the face, it's not suitable. Now, outside that, there's this burning sensation to the face. If you're listening to me and you've had any of this condition, please, today you are knowing the medical condition, the medical term for it. So some have this burning sensation, some this throbbing, some numbness, some dullness to the skin. Now, when we talk about symptoms, there are times we may differentiate these symptoms. Medical personnel differentiate in order for us to know which type of symptoms we're looking at, let's look at the first one known as the paroxysmal TN. It's a symptom, paroxysmal TN. Now, this particular type of symptom is usually sharp, intense, and sporadic. And it occurs, it lasts for either a few seconds to high as maybe 2 minutes. So even when the patient is being, is being poked, you'll find out that they are always interested in knowing the length of this electric shock to the face. So most times that timing matters in order to know which particular symptoms that is being presented in order to determine which particular type to be looked out for. Then the second one is TN with continuous pain. The first one I said is, please, if you are just joining us, TN stands for Trigeminal Neuralgia. Please don't get confused. Now, for this particular one, as the term implies, it's continuous. It's continuous. So you now find the person having this burning sensation. The pain continues over a longer period. So once the doctors are able to identify this particular symptom, they will now be able to determine the next stage of the progress of the patient. Now, those who are just joining me, please, I want to do a summary of all that I have said or all that I have been saying. We are looking at trigeminal neuralgia, and we said it is a condition that affects the trigeminal nerves. And the trigeminal nerve is reactions to your face. One to the optic branch, the second to the maxillary branch, and the third to the mandibular branch. And once there's any suppression to that nerve, something will definitely happen. It's either you're having primary TN or you'll be having secondary TN. And if it is not that, you might be an idiopathic TN that I have elaborately covered here. Please, what are the risk factors for TN, trigeminal neuralgia? Number one, high blood pressure. High blood pressure. Please, if you know you've not been checking your BP, there will be need for you to constantly and continuously BP. If you're listening to me right now and you know for the last 2 weeks you have not done a BP check, we want to kind of your BP regularly. As a matter of fact, there are lots of conditions out there medically that are taking people's lives away. We don't want little things to compound, and we hear the ugly news. It's not going to be in Jesus' name. Yes. Now, if you know you smoke, please, if you are listening to me and you know you still smoke, please kindly drop a cigarette. It will take you nowhere. You will smoke on earth and go to hell. I don't know smoke in hell because smokers don't make it to my own opinion, but that's mine. So please, if you want you to be healthy, and we still want you to be healthy when you leave this world. Now, aging is a predisposing factor. Aging. Though as you age, there is every tendency that you may see a little of TN. Yes, in some people, it becomes more prevalent. So as one ages, TN tends to show itself. Then TN is very common with the female sex, with more than the males. Yeah, but there are so many factors. I will be leaving that. I will be leaving room for my colleagues, Dr. Chooks, and other medical personnel that will be joining us to explain further on today's topic. Then lastly, family history plays an important and pivotal role in people developing. I know and I'm happy that I'm presenting this to you. I'm not alone. I have my team, our team in Super Life, the team headed and led by Dr. Chooks. I'm not the one heading this team. We are all co-assistants. I must commend what he's doing in Super Life Nigeria and other medical personnel like Fam Chilaka and our coach something. And there's a new coach in town, and I am sure by the time he comes on board, you'll be more thrilled to have him. So Super Life is packaging things that will shock us. So we want more and more people to be on our lectures week in, week out. I want please permit me to invite our one and only Fam Chilaka to handle the diagnosis and test, while Dr. Chus will be to handle the treatment alongside our two coaches. Once again, thank you very much. Fam, are you there? Hello, Fam.
Yes, sir.
Yeah, the ball is in your court.
Okay, sir. Thank you, sir. Good evening, everybody. Thank you, Super Life, for this opportunity to be here tonight, and Dr. Igbe for the work done. So I personally have learned about neuralgia, and I will just say some few things on the diagnosis, and like I was instructed, I will leave Dr. Chooks to handle the treatment, right, of trigeminal neuralgia. So doctor has given us basically every vital information that we need to know about this type of chronic pain, right? A chronic pain. When we say something is chronic, it means it's not something that comes and goes. It's not like you have, right, that just comes and then maybe you had a very stressful day, and then you begin to experience headache, or you have malaria or any other bacterial infection that could certain symptoms such as pain, but this one is chronic. Something is chronic. It means something to be diagnosed and categorized as chronic. It means it must have lasted over 6 months. It's something you have been, and these are the things the doctors want to, or because it is we call them the neurotraumas, the neurotrauma doctors, right? Those in the neurotrauma, or some call it neurotrauma unit of the neurology department, neurology units of internal medicine. So in the internal medicine department of the hospital, you have the neurologist. So you have some specific neurologists that also handle pain, or is associated with pain and all. So just to go straight to the point, healthcare provider or the neurologist wants to find out is to be able to differentiate the pain you're having from pains associated with other health problems or similar challenges like headaches, migraines, even post-hepatic neuralgia. okay, neuralgia. Even sometimes pains that are associated with this malaria. So he has to be able to ask you the right questions, so that he able to different, because the kind of pain presented by trigeminal is migraine. Migraine is more or less like headache raised to power three. In uh, back head, the behind your head. It's as if the whole world is on you. You feel the pain every part of your head, especially at the back of your head. As if your head is dropping off. That's migraine, and it's very, very similar to what is presented by thing the counselor want to do is how does he or she differentiate, this pain you are presenting from the maybe migraine or excuse me, or headaches, cluster headaches, and stuff like that. And so in doing that, he has to ask you certain questions like what part of your head, are you feeling this pain more? What part of your head from? Where do you feel the pain more? Is it at your forehead or the low back or the center? Is it, the brain has four lobes. The region where it's occurring would also, inform the um, healthcare provider on the choice of diagnosis. Um, so you ask you stuff like that, and then just to make it easier, we'll definitely do an MRI. MRI is a kind of a scan that we do, so it will look through your brain, right, to know where the problem is coming from, because you are looking at a lot playing out. There is electrical
Huh?
electrical disconnections or electrical sparks, and then going around your labs. So things, all these things are implicated, right? And so he has to do the MRI to figure out, what the problem is exactly. You understand? And so when the MRI is done, you'll be able to, or rather, or the blood vessels is being affected, the spark, where is the problem coming from. So the scan or rather the MRI will actually show the prescribed response for that kind of pain. And it is on this basis that we find, neurotransmitters and neurotransmitters and drugs that are associated with management or treatment of, you know uh, 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 neurotransmissions. That is what brings them into play, because drug to deploy whatever method you want to use in the treatment, it has to be such that it's able to address that neurotransmission that are done by. So basically, there is a blood test being collected because it's not an infection, right? So basically, all the doctor want to do is to ask you questions. The doctor is as blind, as anything, until you to provide information. That is the essence of clacking or probing. It is in the probing that it will ask you those uh, open-ended, or rather open-ended and even closed-ended, that would require you to give them close answers. That's on the response to what treatment provide. The diagnosis, right? So I will give now this doctor choose to take them to handle the treatment.
Thank you. Thank you, Thomas. I think Dr. can allow you to make an input in the area of management and which the therapist can come. Then after this, hello, Dr. Chus. Hello, Dr. Chus. Hello, Doc. That thing can work.
Hello. Hello, country director. Can you hear me?
Yeah, I hear you.
Do we have Dr. Chooks in the house? If he's still just do a summary of the management and treatment, so that we can invite our coaches. Would that be okay? Hello, can you hear me?
Yes, Dr. Chus is in the floor.
Okay, let him go ahead. Thank you.
Doc, can you unmute yourself? I don't know. Somebody muted you again. Can you unmute yourself? Thank you. Okay, you muted yourself. The floor is for you, sir. Hello, Dr. Rove.
Yes, I can hear you.
Go ahead. the network is not fair.
Those who are listening to us for popular TN com. For every organ, there are some side effects and active condition TN. We have anti-seizure medications. We have muscle relaxant. Then apart from that, there are other things that can be given. One way is the medicine want to carry out pain management. They carry out pain management. That means they give certain in combination with therapies in order to manage pain. In some cases, depending which part you're coming from, for instance, they carry out it has been discovered through research that acupuncture goes a long way in helping really type. It's very common in the eastern part of the world as well as meditation. So in all of them, have psychotherapy that is equally being employed. Now, in all of this, in a nutshell, all that time will permit us, Dr. Chu will still come back, or our coaches